pleasure to be here. It's my third year at this conference, and I'm glad to be able to not only be here to talk about some of the things that we plan to do, but actually some of the things that are actually already happening. So far, thanks to Governor Cuomo and the Medicaid redesign team, we have appropriated $388 million in state Medicaid savings to expanding access to supportive housing for high-needs Medicaid members. As was mentioned, we're the only state in the country that has a program like this, and we're excited that some of the projects that we fund, particularly on the capital side, are now starting to come to fruition. There's in fact 7 projects, 7 new buildings that we helped fund that are now going to come online starting this summer and throughout the fall. So we're really excited. Those buildings are not only here in New York City, but in other counties across the state. So we're really excited about the fact that our investments are really starting to bear fruit. To date, we've helped 5,000 Medicaid members access supportive housing through our various initiatives. And so while Medicaid as a funding source is in such a direct fashion sort of new to the landscape here in supportive housing, we feel like we are making an important contribution to the overall effort and making sure that supportive housing is accessible to a larger number of people. In terms of what's the sort of new and up and coming and how it relates to supportive housing is Courtney Burke talked about this morning, exciting opportunity through the waiver that the governor negotiated. We're going to be investing $8 billion into healthcare delivery and improving health outcomes for Medicaid members. We strongly believe that housing is going to be an important component of how we're going to achieve those performance targets. And I also want to mention is that this new delivery system that we're building through the waiver, we really see the waivers like seed capital for really transforming healthcare delivery. And that when we come out the other end of this waiver period with a very different delivery system, one much more focused on improved patient outcomes, but also one where dollars go into these, what we call performing provider systems, these groups of providers, these collaborations, will be coming forward in much more flexible ways than they've ever been available in Medicaid, not only in New York State, but in the country. And as a result of that, we think we're going to potentially open the door to whole new sets of options about how we can connect high-needs Medicaid members who don't have access to stable housing to housing that brings together services that can really help to ensure that they don't use the hospital when they don't need to, don't go into a nursing home when they don't need to. Those are the kinds of outcomes that we're going to try to build into the delivery system of the future. And I think that there's really a golden opportunity here to think creatively about how all of you can be part of that solution to help ensure that Medicaid members have access to the care that they need in the most appropriate setting. So there's a lot to come. I look forward to working with all of you. We're very excited about some of the initiatives we've done so far, but I think there's even bigger things to come.
Great, thank you. Bob.
Thank you. I didn't realize until I got here that I was the real reason I was asked to come was to contrast the youthfulness of the other panel members.
It's only appearance.
Yes,
right.
It's all in the mind, right?
Yeah.
I wanted to send greetings from our acting commissioner, Ann Sullivan. She wasn't able to be here because of another speaking engagement, and she asked me to come, and I actually look forward to that opportunity. As some of you know, I actually came to New York in 1984 as the housing director for the Office of Mental Health, and I've been committed to that since the beginning. The Office of Mental Health has a long history of housing development. We actually started doing housing development in the late 1970s, and in the late 1980s we developed the first supportive housing program for the state, and then in the 90s developed what we call the SRO program, but is really efficiency apartment program, which is another form of supported housing. So we've been in the supporting housing business a long time. We have authority for 47,700 units of housing at this point, and 39,500 of those units are actually in operation, and we have another 9,000 units in development. So a huge part of the OMH budget is committed to housing. That includes housing to help people stay out of hospitals. When I came to the Office of Mental Health in 1984, there were 20,000 people in state hospitals, and now there's about 2,800, and a large reason for that is all the supported housing that we've been able to develop. Besides helping people keep out of institutions, included in our budget numbers are New York 1, 2, and 3. About 5,500 of the 9,000 units of New York 3 are targeted to the mental health population. So we've been very involved in the 14,000 units of New York housing going back to New York 1, and we're very proud about that. In our budget now is also housing to help people move out of adult homes and nursing homes to help with the Olmstead settlements. So the scope of what we do with our housing portfolio continues to expand. Because of this, we've been helping people keep out of institutions, we've been helping people get out of homelessness, and more recently with Olmstead, we've been really moving towards community integration and community inclusion. So I just wanted to talk about 3 themes for the future that I think will affect housing. And Ted and others on the first session really made the point that supportive housing really is a cornerstone, not just of having a good life, but of health. The point was made that the social determinants of health include housing, and that the social determinants of health, things like poverty and education and housing, really have more of an impact on an individual's health than actually access to health care. So housing has to be an integral part of that. And the other part of it is we need to think of housing and supports not just as the resources for supported housing, but as the services you wrap around people. So that's the second theme I wanted to focus on. And the second theme is partnership and integration and a team approach. The RFPs that we're putting out now for supportive housing are saying that the supportive housing provider really needs to join a health home network in order to successfully compete for the application process. So we're really providing incentives to have supportive housing providers work with networks of care. We're encouraging housing providers to become part of health homes and now to become part of these performing provider systems. And I think that'll help to address the intensity and the varying intensity of people's support needs as they live in supportive housing. The supports don't just come from the supportive housing program, they come from the care manager in the health home, they come from the network of care. So the theme in the future, I think, is going to be integration, collaboration, and team approaches, and I really encourage all of you that are providers to be out there and engaging. And it even includes communication around electronic records. We're really encouraging housing providers to become part of the whole movement around electronic record communication. So the second theme is really, and the takeaway here is really to join in these networks. Many of your housing programs are embedded in agencies that do other things, and I think you need to think within your agency how your housing program works with your care manager, your treatment services, and your social supports. The third thing I wanted to focus on was really the concept not just of community integration, but community inclusion. And it's one thing to say that you're integrating people into housing in the community and not segregating them. It's another thing to say that you're really including people in community life, which things like education and employment and income supports. And I think that that federal policy around Olmstead and ADA is really going to be driving policy going forward. You know, we settled with the Justice Department on the adult home and the nursing home litigation, and the administration, Jim Antrone and now Courtney, were integral parts in making that happen, and it's a real, I think, accomplishment for the administration to have settled that in the way that it was done. And the structure of those settlements are really supportive housing with wraparound services from health homes. So again, there's a clear example of that's going to be the future. So I think that the notion going forward would be we're not going to be developing any housing anymore that's just disability housing. We're going to be integrating housing going forward. And I think the wonderful message that Fran was able to deliver this morning is very positive. I think what we need to think about is, as we think about how we're going to address homelessness in the future, we need to think about how we're going to do it in an integrated way to integrate people with disabilities with the general population. So that's really the takeaway. The last thing I wanted to say is that as the Office of Mental Health moves its Medicaid dollars into managed care, we're going to be embedding a home and community-based waiver in that. Home and community-based services, the federal government is saying you can now use Medicaid money not just for treatment, but you can use Medicaid money for supports to move towards recovery. So we are planning to put things like supported employment and supported education in that, but we're also putting housing supports in there. So I think there will be an opportunity going forward where Medicaid dollars will be able to use, not for the bricks and mortar or the rent subsidies, unless we could change the federal government's mind, but will be able to be used to provide the supports for people in supported housing. So thanks.
Thank you.